All right, Module R, cognitive changes due to aging. We are going to discuss and identify cognitive changes that occur due to aging and describe the importance of pacing and patience when delivering care to the older adult. So cognition is the manner in which messages from the five senses are changed, stored in memory, recovered from memory, and later used to answer questions, respond to requests, and perform tasks. So basically, everything that you do as you interact with the world around you, that is part of the cognitive ability of the human brain. So the healthy brain, the healthy aging brain is fully capable of doing everything that you were able to do when you were young. Of course, the brain is a use it or lose it kind of device. You know, if you don't use it, you will lose part of what you can do. They say it's like riding a bike, and some things are and some things aren't. But of course, cognitive function is always related to the use. So the more you use it, the more you repeat those actions or use that information, the longer you'll hang on to it. So there's no notable decrease in cognitive ability and the ability to learn new things in the healthy older adult. You can learn whatever you choose to learn. Thinking and problem solving remains sharp in the healthy aging brain. There's usually no deficit noted, with the people around you. And of course, even as you age, the person generally remains as intelligent, as creative as ever. There is no, well, she's getting older, so things are slowing down. That's not the standard for the healthy brain. So of course, learning is the gaining of information, skills, and knowledge measured by an improvement in some obvious response. So you learn something, you practice it, you get better, it gets easier. That's the general concept of learning something new. The ability to learn obviously remains throughout life, so we can always learn new things. There is no old dog can't be taught new tricks, because that's not true. Older adults learn things easier and better when they're able to set their own pace. So if we're trying to get an older adult to learn something or do something new, it's better if you let them lead the way and take their pace as your pace instead of trying to hurry them up because they should know it already. Sometimes we get impatient with older adults because it takes them longer to figure out how to do something that we feel is simple, like using a remote or using a cell phone or using a computer. These things are not always easy to learn as you get older. Frustration sets in more easily, so it really does go more quickly and better if you let the older adult set the pace. And of course, this depends on the person's memory. Sometimes it is harder to learn new things. It takes longer to learn new things than it used to. But if you're working with it and using your brain will still work for you. And of course, memory. What is the definition of memory? The book's definition, it involves the storing of information in the brain for later use and the ability to recall that information when needed. So if you can't remember it when you need to remember it, then it's not really a memory yet. It's just information you know that has yet to make that connection in your brain. So let's talk about what happens when the brain ages. Cognitive changes due to aging include the size of the neurons progressively decreases, so the brain cells, and the total mass of the brain actually decreases in size. So the brain does get smaller as you get older. Responses slow down. So your reflexes aren't as good. You aren't able to respond either psychologically or physiologically as quickly as you used to. It takes more time to learn new activities. You have more difficulty in learning new motor skills. So sometimes learning a new task or activity that takes physical agility can take much longer to learn. And of course, you have a decrease in processing time. So it takes longer for you to process, it takes longer to respond, and it takes longer to react. These are things that we expect to see in the aging adult. Older adults become more deliberate. They do less frequent responses, so they're thinking about what you said before they respond to it, so they can make sure they understand. They're less effective when forced to perform at a fast pace. They don't adapt very well to that speed. So you really don't do anybody any favors if you go in there and try to do things really quickly, say a bunch of stuff really fast, and then expect a response, because chances are you're not going to get what you want, because they're going to need you to go back and repeat everything you just said. They're very easily confused. So if you say too many things at one time, they didn't really catch all of it. So you're going to have to go back and actually repeat yourself maybe 3 or 4 times. It's not going to be the kind of thing where you can just go in and blurt out a lot of information and they're going to grasp it and you can leave. You're going to have to actually slow down, because if you're trying to do too many things at once, you're trying to make too many changes or give too much information, you're not going to catch their attention. They're actually probably going to block you out. So you've really done no good. So patience and pacing. Be patient, slow it down, work at their speed. We do expect to see some mild short-term memory loss. So things, I can't remember what I had for lunch. I can't remember, what day, what's the day of the week. I've lost, is it Tuesday or is it Wednesday? I can't remember where I parked my car in the parking lot. These things are normal. They may have poor recall of, something that was said to them earlier today, or maybe something that happened yesterday. So it's important to just understand that that's normal for them. That's normal for the aging adult. So you really do want to be patient. Just repeat what you said. If they ask you, what was that about? Or what did you say? Just repeat. Their motivation to learn decreases. Why do I need to know it? I've gone my entire life and not known this. So why do I need to know it now? That is very normal. They have no motivation to learn new things. So they probably will be reluctant in trying to learn new things. They may feel threatened when changes are evident to the public, so they're embarrassed. They know people don't, they realize that you don't know, or that they don't know what you think they're supposed to know. That bothers them a lot. So it's important to make sure that that's perfectly understandable. I would have forgotten the same thing too. Kind of play down the event so you can mitigate their feelings of embarrassment, or feeling like maybe there's something going on and they aren't comfortable with it. It gets more difficult to do more than one task or deal with more than one request at a time. Multitasking becomes something of the past. They try to multitask, and inevitably something very well may get lost, missed, or not done. And they have a very hard time ignoring that external stimuli. So when the TV's playing and somebody's talking to them, they have a hard time filtering one of those 2 things out. Generally, if someone's talking to them, they're having a hard time filtering out the TV. If they're trying to watch the TV and someone's talking to them, then whatever you're saying is getting lost in the mix. So when you go into to talk to an older adult, or have a conversation, maybe do an education session, Module 6 talks about, restorative care. If you're trying to do something like that, then you're going to want to reduce the external stimuli. Turn off the TV, turn off the radio, turn down the volumes of different things. Make sure they've got their hearing aids in, make sure the hearing aids are turned on, so that you can get their full attention and make sure that they are with you as much as they possibly can be. So reaction time slows down. It takes more time for them to begin to answer, and they become very, very deliberate in that response. So it's important when you ask them a question, give them time to respond. Don't just, are you ignoring me? Unlike, we speak to our children, be like, I told you to do something, why didn't you answer? For an older adult, they're actually processing what you said. So give them a chance to respond before throwing in the next question. It's not that they're ignoring you or don't want to respond. You need to give them the ability to actually respond. So reaction time slows gradually after age 16, so it takes longer for them to begin to answer, especially when the older adult has to make a choice or change movement from one direction to another. So you may have noticed that your grandparents, or maybe if you have older parents, they don't just stop, turn around, and go pivot the other way. They stop, they give it thought, and they'll turn around. It's a very deliberate action. Same thing with a response. You may ask them a question, give them a long pause, 15, 20, 30 seconds, and then they'll start to respond to you. So there's no reason to expect them to do anything else, because this is normal for the aging brain. And of course, you come up with impaired sensory deficits, difficulty seeing, difficulty hearing, chronic diseases like diabetes, heart disease, things like that. They also become part of what happens to this cognitive ability. They affect it. So be aware of changes in reaction time and pace accordingly. like I said, where you give them something and then wait for them to respond. Develop understanding of ways to help the resident make up for that slowed reaction time. So this is where pacing comes in. If you don't seem rushed, they won't feel like they're being slow. There's a lady in my neighborhood. She walks with her very, very old dog. He walks very slowly, and she walks very slowly beside him because that way he doesn't know that he is, walking. He doesn't think he has to be walking any faster. He doesn't feel pushed. The same thing is true for people. If you are walking or working at their pace, then they will not feel like they are holding you back. They will not get frustrated with the task you're trying to get them to do, even if it's a task they do every day. So when you're performing ADLs, you're walking and you're helping them with their bath. They're taking a little bit longer. If you're patient and go at their pace, then they won't feel like they've done anything wrong. If you're trying to hurry them, they may feel like they're not doing it well enough. And then that makes them feel bad about themselves, and that's where it becomes a negative effect on their self-esteem. And that's definitely what we don't want. And of course, we know nurse aides have a lot to do. There's a whole lot of stuff that has to get done in a very short amount of time. So sometimes we innately speed them up because we're in a hurry. We have more to do. I don't have time to sit here for 20 minutes and wait for Mr. Smith to do whatever Mr. Smith is doing. I've got other things I need to do. So we don't intentionally try to quicken the pace, but we inadvertently do. So you have to be cognizant of that. Think about it, pay attention to it, and make sure that you don't let it happen. And don't let it show when you're taking care of a resident, especially if that resident is requiring a little extra time to do something. And if you want an idea of kind of what it's like, say you were taking a time test. You knew you had 30 minutes to do this time test, and 10 minutes in, your instructor told you only had 20. Now you feel that kind of pressure, right? Oh my gosh, now I have to do it in a hurry. So the same thing occurs when you try to speed somebody up who is requiring, who needs that extra time. So, kind of put yourself in their shoes and make sure that you don't want to inadvertently try to make them work at your pace. Instead, you want to work at their pace. Of course, the effects of a fast pace on the older adult, it affects their ability to learn, to perform the task and maintain motivation. They'll just quit. If you try to speed them up too much, you know what, you just do it. I don't want to do it, you do it. The older adults become more cautious and less willing to respond, so they're not going to be as fast, or as engaged when trying to do something. And some may choose not to even do the task at all because they're afraid of failure. So they don't want to fail. If I don't do it at all, then I can't fail at it. So at that point, then you've completely lost their motivation altogether. When that happens, then we come up with this thing called social breakdown syndrome, which is what we don't want. If your resident is rushed and not enough time, they'll stop doing it for themselves and expect you to do it for them because, well, you just do it faster anyway. It's just easier to let you do it for me. Then at that point, they become dependent. And we don't want the older adult to become dependent on us. We want them to maintain their independence as long as possible and to be able to do for themselves as much as they can do for themselves for as long as possible. So when we rush them, they stop trying for themselves. They then just want us to do it for them. And then they become dependent on the caregivers to do whatever needs to be done. They lose self-esteem, they lose confidence, they lose the ability to even be independent. So we have then created a bigger problem by not being patient. We certainly don't want them to blame themselves for not being able to keep up with the pace that we have set, because again, it's not ours to set. It's actually for us to meet their need, not for them to meet our need. We serve them, right? And of course, society becomes very impatient with those who cannot keep up. But as I get older and become that slower driver, you know what? If you need to go around me, you go right on ahead. I'll still be here when you get back. So try to make sure that you don't put this on your people you're taking care of. Because again, once they feel like they've been labeled as slow or not being able to keep up, then that affects their self-esteem and their confidence. And again, they don't keep up with us. Like I said, we need to slow down for them. So of course, patience and pacing. Pacing is the awareness and adjustment of care based on how slow or how fast a person is. Not everybody, as they get older, is going to slow down. That is very true. Everybody ages differently. Everybody's age brings different. Our brain ages differently. But we meet their pace, whatever that is. The patience is the ability to deal with that slowness, that delay, without complaining or appear rushed or appear agitated that it's taking so long. So you want to make sure you always show patience when you're taking care of a person, because the second you lose patience is the second you become agitated, and then that is when they then start to feel like they're doing something wrong, when in actuality they have done nothing wrong. And of course, patience and pacing can be used to offset the effects of a resident's slowed reaction time. We cannot say that enough. It is very important to use patience and pacing when dealing with the older adult. Of course, when you use patience and pacing, older adults are better able to perform and learn new things. They have time to use the assets that they have to the best of their abilities. And they feel better about themselves. They do not feel like they're slowing anybody down or that they have lost control. They feel competent in what they're doing. And again, that's how them control back as well. So we don't want them to ever feel like they're a burden or a bother. The fact that they're taking a little longer is a big deal, because it's not. We will adjust to them. And of course, as the nurse aide, slow your pace down when working with your residents. Let the resident set the pace. Ensure the resident is wearing their glasses and hearing aids so you have the best of their resources. They can see what you're doing. They can hear the questions you're asking. They can follow your directions and demonstrations. Sometimes you have to encourage them a little bit. You want to make sure they have their hearing aid and glasses on. And tell the resident ahead of time what's going to happen. This is one of the reasons why we like to explain what's going on, so the resident has time to absorb the activity that's getting ready to happen, so that we can make sure that they can give consent and be fully compliant, participate in the care, in their own care. We always want to allow time for the resident to focus their attention on the task. Again, you want to give them that pause so they can make sure you have their full attention. Allow time for the resident to think about what's been said. Use clear, short instructions. No need to use big words. I'm here to give you a bath is perfectly fine. You don't need to give a lot of lengthy instructions either. You know, we're going to turn you on your side. We're going to, I'm going to help get you dressed. Simple things, words they understand. And of course, relate new information to tasks in the past. Most of you have not cared for somebody, or even if you have, you may not have realized what exactly is going on until you started taking this class. So you're learning a lot of new information, and it's, you're learning a lot of new skills. For the older adult, the skills they're learning may be different, but they may be learning new skills as well. So you kind of put yourself in their shoes, have empathy for them, and allow them the ability to be as successful as they possibly can by letting them set the pace and being patient with the pace that they've set. Simple words, show the rest going to be done. Demonstrate. They may not, their hearing aids may not be turned on or turned up. They may not have their hearing aids in. Sometimes showing them what you want done is, doing the demonstration is the best way for them to learn. There are a lot of different ways to learn. You learn by practicing. Some people learn by thinking about stuff. People learn by hearing things, seeing things. The demonstration while you're explaining it is always a good option, first option to go to give them the ability to understand what you want done. And of course, especially if we're teaching them something new that has to do with new equipment, you want to let them look at the equipment, handle the equipment, figure out how it works, so that when they go to use it on their own, they are very, very comfortable with it and very familiar with it. And of course, we always praise the resident. We always praise the successes. We always focus on the successes. We don't really focus on the failures. We don't want the resident to focus on the failures. I didn't do a good job. I didn't do what I was supposed to do. You really don't worry about it. It's new. You're learning something new. We all have struggles when we learn something new. You did great with this, and this, and I think you'll do great. You'll do better tomorrow. The next time it'll be great. We always focus on the success. Always pump up the resident. We want to make sure that we make them feel good about themselves, that they build up that self-esteem and confidence, because you do want them to have the motivation to try again. You don't want them to focus on what they weren't able to do. You want them to focus on the things that they were able to do. So then tomorrow, hopefully, they'll be able to do more. Or the next time you sit with them or do a session with them, they'll be able to do more. So, we want you to interact with the residents or the people you take care of in any way, shape, or form that makes them comfortable. So, you're comfortable giving them a hug is praised, then great. If it's a high five or a fist bump or, whatever meets their needs for inclusion and meeting that acceptance role in Maslow's hierarchy, that's what we want. That's the purpose of that. So that is Module R. I definitely recommend you look at the progression test. Actually, you may not have the progression test in the back of your book. Definitely look at your, when you give care, when you're taking care of somebody, give some thought to how you can add patience and pacing in that to make it more effective and more conducive for the person you're working with, not necessarily for you. So that is Module R.